Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live happier, healthier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare, Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be speaking with Allison Young, CEO of United Healthcare Community Plan of Louisiana, who will talk about the $250,000 donation made to Baton Rouge Area Foundation to benefit 5 nonprofit organizations. In a recognition of May being Mental Health Month, we'll be speaking with Shannon Williams, Education Coordinator for NAMI, and Chantrelle Varnado Johnson, a NAMI New Orleans board member and licensed counselor. And joining us today for our Eat Fit NOLA cooking segment, we'll be in the kitchen with Judith Montalvo of Cafe Zucchini at Ochsner Fitness Center. So don't go away, we'll be right back with more Community Health Heroes.
When I was 6, I had one thing on my mind. When I was 6, my days were spent playing basketball every chance I could. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke. I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Protect the ones you love. Spot a stroke. F-A-S-T. Fast.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit.
Okay, I get it. I'll do better. Just, please, don't leave.
Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Welcome to Community Health Heroes. Did you know that thousands of people are still rebuilding and recovering from last year's floods in South Louisiana? Joining us today to tell us what United Healthcare Community and State has done to help people recover is Allison Young, CEO of United Healthcare Community Plan of Louisiana. Thank you for being on the show today, Allison.
Thank you so much, and thank you for having me.
Oh, it's my pleasure to have you on the show again. So tell me about United Healthcare's $250,000 donation to the Baton Rouge Area Foundation.
Oh, we're really proud to say that on April 7th, the United Healthcare donated $250,000 to be administered by the Baton Rouge Area Foundation. We were proud to have the First Lady, Donna Edwards, join us in our opening ceremony, and we gave the money for flood relief.
Well, how did United Healthcare choose the Baton Rouge Area Foundation for this donation?
Baton Rouge Area Foundation has been extremely active in flood relief and has organized community organizations from all around the region. And so they were the logical candidate to help us with this donation.
So when you say they organize other organizations, like give me an example of who they organized.
Well, for example, we gave money to the SBP, which is the St. Bernard Project. Okay. They've been doing rebuilding in the Baton Rouge area, and they've been involved in flood relief around the country. We've also given money to Mid-City Redevelopment Alliance. They also are very involved in restoring seniors and businesses in the Baton Rouge area that were impacted by the flood. We gave money to the Southern University Law Center they organized a disaster relief clinic.
Oh, wow, that's fascinating.
It was. I didn't realize all the legal issues that come to play. When you think about homes that have been in the family for generations, who is the true owner? And all the succession issues that go with that. In order for them to borrow money or qualify for federal grants, they had to prove that they were in fact the rightful owner of the properties. So those legal issues became extremely important.
Wow.
We gave money to Louisiana First Foundation, which was headed by the First Lady, and Women's Hospital, because we wanted to be sure that women had access to mammograms. So their mobile mammogram unit was out and about as soon as it was possible, and we wanted to support that effort.
That's awesome. So how did United specifically choose the Baton Rouge Area Foundation? I mean, was it just that they were just so fascinating? Was it their history?
They have a strong history, particularly in the Baton Rouge area. They have been in business for nearly 50 years, and they have a very solid financial footing. So we wanted to partner with an organization that we knew would do the best for the community, and they have been organizing flood relief meetings for the past several months.
Wow.
So they were really the logical choice.
That's great. Why is it so important that community, like United Healthcare and other large corporations, donate to societies like that?
Remember, we are all participants in the community. And when our community is challenged, everyone is challenged.
Absolutely.
When people are displaced from their homes, their health naturally suffers, and we want people to get all of their preventive medical care. And if you are displaced from your home, you're really not thinking about going to get your mammograms or going to get your well baby visits. Your first priority is your home.
Absolutely. Food and shelter.
And food and shelter, absolutely. So we wanted to really focus on flood relief and doing our part. We are strong members of this community, active in all kinds of organizations, and we thought it was we had an obligation to do our part.
Right. It's very compassionate because, like you said, people are worried about food and shelter. They're going to put their health on the back burner.
Absolutely. And we want to help people get back into their homes so they can get back to living normal lives.
Oh, that's awesome. Are there other donations that are in the works?
Well, actually, the United Healthcare Foundation has invited a number of organizations to participate in two topics. One is social determinants of health.
Oh, that's so important.
It really is. You'd be amazed at how many healthcare conditions, as you well know, are really caused by social issues. And secondly, focus on the health of seniors.
Oh, that's incredible too.
So the foundation has invited a number of organizations in the area to apply for a grant in those two areas.
And if we wanted more information, would we go to United Health Foundation's website, or how would we get more information?
Absolutely. United Healthcare Foundation would be the best place to go.
Well, I thank you so much for coming on the show again and taking the time out of your busy day.
Thank you for having us. And, United Healthcare is doing important work in the state, and it's been my pleasure to be here.
Thank you, Allison. When we return, we'll be speaking with representatives from NAMI in recognition of National Mental Health Month. So don't go away. We'll be right back with more Community Health Heroes.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up, and be the next one.
Find out how you can help at thenextonesela.org.
Welcome back to Community Health Heroes. May is Mental Health Month. Did you know that certain seemingly common behaviors are risk factors for or indicators of mental health or substance use disorders? Joining us today to give us an update on the state of mental health in our community are Shannon Williams, NAMI Educate Coordinator, and Chantrelle Varnado Johnson, NAMI Board Member and Licensed Counselor. Welcome to the show, Shannon and Chantrelle.
Thank you for having us.
Thank you.
So May is Mental Health Month, and I think you guys are going to be telling me about some risk factors or indicators if you suspect your loved one has either mental health problems or possibly substance abuse.
Exactly. So mental illnesses are very common. 1 in 5 individuals experiences a mental illness in any given year. And actually, 50% of chronic mental illness starts at age 14. And 75% starts at age 24. So it's far more common than we realize. It's also far more common in our young people than we realize.
And teenagers have their own issues, so
exactly.
How can you tell if they're having, what kind of signs and symptoms are they going to be having?
So there are a few different things to look out for, and sort of like you've touched on, you know, sometimes it's hard to tell what's normal teenage behavior from what may be something else. But the real focus is on whether they're substituting, you know, certain behaviors for other healthy ones, or if they're not. So examples would be when young people, you know, start getting into their teenage years, they maybe withdraw from their parents, but usually that's because they connect more with their friends.
Right.
If they're not connecting more with friends or other people, if they're kind of withdrawing to themselves, that can be a warning sign.
Like being in their bedroom all the time?
Yes. If someone, you know, has, you know, switches from childhood interests to different interests, that's a normal teenage behavior. But if they lose interests that they really enjoyed and don't pick up new ones, that can be a warning sign.
Chantrelle, what kind of things have you noticed in patients that have mental illness or substance abuse?
Some of the things that I have noticed include depressed mood. In addition to that, diminished appetite, disruption in sleep patterns, can also be an increase in aggressive behaviors, along with...
Like outbursts?
Yes, like emotional outbursts, irritability, blaming others for their actions, and then also it can be like lying, stealing, manipulation.
Well, those are all kind of scary. So what does a loved one do if they notice some of these things in their loved ones or family members?
Well, the important thing is to not, you know, get, you know, overly concerned or scared. Like I said, these are very common conditions, and there's hope. There's a lot of resources out there for people living with mental illness and substance use, but also their loved ones. For example, NAMI New Orleans has a lot of free services for both of those groups. We have support groups. We have classes, we have presentations we give to the community.
So it's not just for the person that's impacted, but it's not the individual, but the family who gets support.
Exactly, and we see those support groups are incredibly helpful. Chantrelle is actually a facilitator of one of those groups. And they're basically really helpful for individuals who are trying to help a loved one, but, you know, different circumstances make it very hard or maybe even impossible to help them at this time. And it's just a place where family members can go find other people who are experiencing the same things, because trying to help a loved one with mental illness can be incredibly isolating, just like having a mental illness can be isolating, because the stigma is so pervasive that, you know, we don't want to tell other people. Even if we do, they may not understand, or they may, you know, treat us or our loved ones differently just because they find out this new information. So the support groups are incredibly helpful for people who are trying to do their best to assist their loved ones.
And Chantrelle, what kind of techniques or tips do you share with family members?
As far as tips or techniques that I share with the family members is to begin with being able to foster an environment where the family member feels supportive. In addition to that, if the symptoms appear to be persistent and chronic, is making sure that they seek medical attention, such as following up with the primary care physician, and then also if they need other supportive services such as medication management or following up with a counselor or social worker.
So you're really offering, like, you know, maybe your loved one should see somebody, maybe take some medications if that's appropriate, or get some counseling if that's appropriate.
Yes. Another thing that I typically share with some of the family members within the support group setting is also making sure that they're receiving adequate self-care. Because at times it can be very debilitating when you have a family member who's going through this, and at the same time, it may take an emotional toll on you.
Absolutely. So they may not take care of their own needs.
Yes.
Oh, that's really sad. What are we doing in New Orleans to deal with a nationwide opiate epidemic that's going on? I mean, that's huge. It's not, you know, just New Orleans, it's everywhere, but what are the statistics around that, and what are you guys doing for that?
I mean, so we've actually, the statistics have just recently come out that opioid deaths have surpassed homicide deaths in New Orleans.
Oh my gosh.
Wow. It's an incredibly, you know, enormous
problem, absolutely,
epidemic that's happening. So New Orleans is doing a few things. Also, nationally, there's a number of things that are happening. I think the national government has just recently awarded New Orleans a good sum of money to help fight the opioid epidemic. We also are expanding use of naloxone, which is the anti-overdose medication.
Like, are you giving it to paramedics or supporting, you know, first responders?
So not NAMI specifically, but what is being done is that, you know, all paramedics and EMS are being trained in its use and carry it with them. It's even being introduced in schools. It's being introduced in other clinical settings.
Like family practitioners, or
yes, anywhere basically where this could be of use. And it's being distributed free of charge. Someone just has to go to the training to learn how to use it properly.
Absolutely, use it properly.
And so that's something that really has been saving lives, luckily. But we need to do much more preventative work rather than, unfortunately, waiting until someone, you know, has an addiction and then possibly overdoses.
Look back at those signs and symptoms you were telling me about, because mental illness is often linked to substance abuse.
It really is. If someone has a mental illness, they're far more likely to develop a substance use disorder and vice versa. And it's much harder to treat someone who has both conditions at once, because we have to treat both at once. We can't say, I'm going to treat one and then the other.
Right. They're too close together.
Right. And unfortunately, a lot of times people with mental illness begin using substances because they're self-medicating. They're not getting the treatment
feel better.
they need. Yes.
Right.
And if our mental health treatment was more comprehensive and didn't let so many people fall through the cracks, then maybe we would avoid more substance use disorders as well.
So I understand that you have a fundraiser coming up in July.
We do. It's called NAMI Rocks and Bowls. It's held at Rock and Bowl, everyone's favorite bowling alley. And it will be an evening of bowling, music, food, silent auction, all to benefit NAMI New Orleans and the free services we provide. So it's going to be just incredible. We're going to have musician Chuck Credo IV and his friends play the night away. It's just going to be a fantastic event. So we hope everyone can come out on July 7th. And more info is available on our website.
And what is your website, so that in case we want info about NAMI or any of your programs?
So our website is namineworleans.org. You can also reach us at our office number, 504-896-2345. And we can answer any questions when you call. And our website also has more information about our free services, about the services we provide for Medicaid and Medicare recipients, mental health first aid trainings, just a ton of wonderful things to help people know more about mental illness and know how to help people living with mental illness.
That's awesome. Well, thank you both for being on the show today.
Thank you for having us.
Thank you.
When we return, we'll be in the kitchen with Judith Montalvo of Ochsner Fitness Center's Cafe Zucchini. So stay tuned for more Community Health Heroes.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Hi, I'm Molly Kimball, registered dietitian with Oxnard Fitness Center and with Eat Fit NOLA. We're a nonprofit initiative that works with local restaurants to highlight the better for you items right there on the menus. We now have over 180 partners, and that spans over 5 regions. So the Oxnard Eat Fit program has expanded beyond Eat Fit NOLA to Eat Fit Bayou, Eat Fit BR, Eat Fit North Shore, and beyond. We're honored that United Health Foundation and Community Health Heroes features Oxnard's Eat Fit program every month, shining a spotlight on one of our talented Eat Fit chefs, whipping up dishes for you that are nutritious and delicious. So don't go away. Community Health Heroes will be right back.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back. Joining us today in the kitchen is Judith Montalvo of Cafe Zucchini and Emily Elkhoff of Oxnard's Fitness Center and our Eat Fit NOLA program. Welcome to the show, ladies.
Thank you so much for having us.
What are you preparing for us today?
It's an Eat Fit Greek yogurt chicken salad.
And so what's in this chicken salad?
It's a really basic chicken salad. You know, it has the celery, the green onions, parsley, which is very important. And then you can also, I'm going to show you some variations of it, like a Napa chicken salad, our curry chicken salad, which it has cashews, golden raisins, curry powder.
And so what makes it low calorie? Is it sour cream or is this yogurt?
That is Greek yogurt.
Yes, so our EFIT team, specifically our registered dietitian Alexis Wellbacker, has been working one-on-one with Judith to introduce some healthier options at Oxnard Fitness Center. So we've swapped out the flour wraps for the whole wheat wraps. We've also swapped out the mayo for the Greek yogurt in our chicken salads.
Wow.
So that really gets rid of some of those animal-based fats, also bumps up the protein, and it tastes delicious as well.
So what other dishes has Judith made for us?
Well, this is one of the things that I'm making. Actually, this is a basic Greek yogurt chicken salad. This one is the Napa salad that we also feature at our cafe. And that one just is with grapes. So, you know, it has all the Greek yogurt and all the fresh veggies too.
Okay.
This is a 100% whole wheat turkey sandwich.
Okay. And what's in the wrap?
That is also 100% whole wheat wrap, which is really delicious. It's our all NOLA wrap. And it has spinach, low sodium turkey, tomatoes, and Swiss cheese.
Well, while you go ahead and prepare this, I'm going to ask Emily some more questions. So go ahead and start cooking.
Just to talk about the turkey for a second, we actually, in the Fitness Center has introduced one of the lowest sodium turkeys we've ever found. So usually deli turkey can be somewhere around 800 milligrams of sodium, which is a ton of sodium. This one has about 20 milligrams. So
oh my gosh.
It gives us a lot of leeway as far as seasonings, cheeses to add, things like that as well.
Oh my gosh. So how long has Cafe Zucchini been in the Oxnard Fitness Center?
That's like
15 years.
15 years, yeah,
Wow.
a long time.
And when did you start partnering with Eat Fit NOLA?
It's been a couple of years, I think. They've been so helpful with changing things like that, basic things, and make everything healthier. We're trying to get more Eat Fit items into the cafe. We do have a lot. We have smoothies, we have sandwiches, we have wraps, we have hot meals like chicken and some
So you can
side
actually
items.
go there and purchase a nice hot rotisserie chicken
Yeah, that's
and
correct.
take it home or eat it there?
And get some Eat Fit side items too.
Wow.
And the best part about it is that you don't even need to be a member of Oxnard Fitness Center. If you work in the area or if you live in the area, you're always more than welcome to just go into the cafe and get some delicious Eat Fit items there. So they have Eat Fit smoothies, cold dishes, hot dishes. They even sell our PJ's Protein Velvet Ice.
What's that? I've never heard of PJ's Protein Velvet Ice.
Delicious.
Yeah.
So tell me about that.
PJ's is the coffee that the cafe uses, and we did partner with PJ's recently to introduce a lower sugar, high protein velvet ice. So it's perfect as a snack, as a meal, all of those things. It meets those requirements.
So it's healthy for you.
Basically, it's taking those frozen coffee drinks that are usually terrible for you and making them really good for you, actually. So
what is going on that's new with Eat Fit NOLA?
So we have a ton of things going on. We're at Shrine Stadium with the Zephyrs. We'll be in the Superdome this coming fall with the Saints. And just various events around the community. Once a month we're going to be in the Crescent City Farmers Market, also doing demos with our Eat Fit chefs. So definitely come check us out.
So you're going to be in the farmers market actually preparing some food?
We are.
Oh
so
my gosh, how
we were there
exciting.
yesterday. We did that yesterday, and it was a great time. So
now, isn't there like a new app or something that's changed with your app?
Yeah, so our app is a really great resource for anyone looking to find Eat Fit dishes. They can open it up, and based on their GPS location, it'll show you all of the Eat Fit restaurants around you. Not only that, though, it'll show you all the Eat Fit dishes there, a picture of them, and all the calories, protein, fat, and carbs on the app as well.
That's really robust.
Yeah.
And how do I find it? I just go to the App Store?
Go to the App Store and type in Fit NOLA,
Just
and it'll
Fit NOLA.
pop. Yeah.
Okay. Well, that's awesome.
Yeah, it's a really great resource.
So Emily, what other locations are you going to be in the coming future?
Yeah, so we actually just partnered with Whole Foods. We're gonna have, we actually went through each and every aisle of Whole Foods and picked out our top 3 products of basically every category. So from your salsa to your cereal, we have our 3 Eat Fit picks based on the nutrition information and also the ingredients as well. So these are gonna be cleaner ingredients, lower in calories, lower in those animal-based fats, very high in protein and high in fiber, those good things that you like to get. So watch out for us at Whole Foods. You'll find our orange Eat Fit logo on your Whole Foods grocery store shelves.
And coming soon, you're going to be in vending machines.
Yes, so we just launched our vending, Eat Fit vending as well. We're going to be all throughout the Ochsner health systems with our vending machines, so you can get even faster food that way as well.
Especially when you're in the hospital or visiting somebody in the hospital, that's going to be an awesome option.
Yes, it really is.
So we're all done here. Can we see that beautiful final product?
It is very, very fast, very easy.
It's fast, it's easy, it's colorful.
Wow, that
And
is
if anybody ever wants a recipe, seriously, just go and ask me.
Or go to our Eat Fit NOLA app.
Yes, our Eat Fit app is definitely a great resource for that.
Well, thank you both for being on the show today.
Thank you again for having us, as always.
And we'll be right back with more Community Health Heroes.
Hey, Hard, what's this? That's my resignation letter. You're resigning? Why? Because you're constantly ignoring me. You're half as active as you used to be, and you get stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit. I forgot. I'll do better. Please, don't quit on me. Okay. But remember, it's not what you say. It's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
Thank you so much for joining us. If you would like to suggest a health topic, send us information on our health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. You can also find us on YouTube. We hope that the information we've provided today has helped you and your family live healthier and happier lives. I'm Dr. Penny Walker. Join us next time for more Community Health Heroes.